Welcome to our third Global Ovarian Cancer Charter Summit event. I'm Clara McKay, CEO of the World Ovarian Cancer Coalition. This event is about the supportive care needs of women living with the diagnosis of ovarian cancer and their family. But it's also about the many amazing organizations, patient advocacy organizations around the world that provide support to meet those needs. And indeed, many of the organizations who are involved in the ovarian cancer community and the wider cancer community have actually been started by people who were very motivated by their own experiences in terms of either living with a diagnosis of cancer or a family friend or partner, and really responded to the gaps that they experienced and the unmet need, and felt brave and motivated enough to actually start organizations from scratch or really develop small organizations. So today we wanted to highlight and have a conversation with a couple of people who have firsthand experience of either setting up a cancer organization or taking on a very newly established organization and building on it. Both of our guests do have experience starting their own organization, so and different lengths of time. So I think we'll have a really interesting discussion about their experience. So I'd like to introduce to you Elizabeth Baugh. And Elizabeth is chair of the World Ovarian Cancer Coalition, but she's also CEO of Ovarian Cancer Canada. And also, and some people may not know this, but Elizabeth many, many years ago started her own not-for-profit in an area that was near and dear to her heart, so she can draw on that too. We're also joined by Rafe Adel, and Rafe Adel, who is based in Bangladesh and who started not all that long ago a cancer website called Cancer BD, and that was he developed that because of his strong feeling about the need for people to have more access to information. So thank you both for joining us. It's early morning for Rafe and getting late into the evening for Elizabeth. So thank you.
Thank you, Clara.
Yeah, so Rafe, maybe I'll start with you. I know very sadly your mom died from ovarian cancer, and that was for sure your motivation. But can you tell us a little bit about that experience and why you then felt compelled to set up Cancer BD?
Thank you, Clara. Basically, it was in 2010 when my mother diagnosed in the third grade ovarian cancer. And what else? Basically, a country like us, developing country in Bangladesh, we are facing so many problems. And in our, if we look at our health system, that was poor then, and we don't have any specialist cancer hospital over there, but we have a few good physicians here in Bangladesh. But in terms of diagnosis and treatment, we were in a very bad situation over there. And the cancer patients' relatives were mostly, I'm also including those people. We are facing a very hard time in terms of informations because we even don't know where we have to go, where we will get all the updated informations, and mostly if we look at looking for native language informations in native language, that was zero. So we have to face so many hurdles regarding these sort of informations because if you don't have the basic knowledge, you can treat cancer disease. So this was the main reason when I have decided to run something like or prepare something in the digital platform where all the informations will be available in our native language. Because that time I was graduated from a university, but we have so many people who doesn't have a minimum education. Even in our country, so they can also face the same thing, and they need to have the cancer literacy. So without getting the native language informations, you can't really understand the cancer and the basic needs or the basics treatment procedure of cancer. So this thing has actually motivated me to introduce this cancer-based awareness website in our native language, and we have initiated that just 4 years later in 2014. And at that time, our information minister, Honorable Hassanul Haq Inu, has inaugurated our cancer.net, because we are able to convince him actually that this is the main thing, and in any types of diseases we need to have a source of informations where anybody can access their informations from that specialist website. And that is the only thing to make people aware. If we can introduce any websites, specific website for specific diseases in native language. And he was very convinced and appreciated them. So this was the journey, and not only me, my family members and my countrymen and my community peoples always input so many suggestions every time, because they own that websites, and now we are trying to work countrywide. So let's see. It's a good journey for me,
Oh, that's
and
brilliant.
good journey. Yeah.
Yeah, and I really think it's interesting that it was such a basic need, that the lack of medical and information about ovarian cancer and ovarian cancer
Mhm.
treatments, that you and your family and your mom couldn't access that, just a very
Right.
basic need. And you did tell me last week, which I enjoyed, that you became a bit of an armchair physician yourself, became an expert on
Yes.
such an expert that
Uh,
you that were used to carrying on medical books, but you were literally translating, writing out and translating information to make it
yes.
accessible to cancer
Mm.
patients in Bangladesh,
Even
which is amazing.
Yeah, even I bought a few medical dictionary. Those were very weighty and very heavy to carry. And somebody that you're a student of arts, you're a student of political science. Why you are buying these books? My friends are then joking at me, but then I have. I have to say that those people, that there are so many medical terms when I got to internet, when I Google them. So I have to understand what is going through my mom's treatment. So uh, there is no other way. I have to buy those books, and those dictionaries English to English. Not there were no dictionaries English to Bengali. Then I found something like that, and we have to go through these struggle. I don't want to say these are struggles. These are educations. These are
Yeah,
educations for myself, and I'm just conveying these educations through my website right now to the mass people.
I think that's an amazing story. And
Yeah.
Elizabeth, you also have a very kind of interesting experience in terms of when you came to Ovarian Cancer Canada. That was from the organization that you had been a founder of, from About Face. And I wonder, was it different taking on a small organization as a CEO? Did that Was that different from your experience as a founder and leader?
It wasn't that different. I think what it gave me insight into was it was my About Face was my test, my pilot, if you will, and I learned so much. So I think that I felt that I left About Face because I felt it needed to have someone other than the founder to make sure the foundation was strong and it would continue to grow, and it has. So I understood how hard it would be for the founder of Ovarian Cancer Canada to turn the leadership over, if you will, to someone to carry out the vision. And I think that was a place I had some understanding. I also think I had seen the impact of really understanding what the need was, as Rafe has described, really knowing what the community needs. And we were very fortunate that our founder was a very powerful politician, and he had been able to acquire funds for us to hold a forum. And prostate cancer and breast cancer had done this in Canada. And so we modeled what we had done on how they had learned their best practice. And we had a 3-day forum where we interviewed and listened to stories from women, clinicians, researchers, policymakers, corporate pharma companies. And every afternoon, we discussed those things for 3 days. And at the end of the 3 days, we had a blueprint for action. So we knew where the information was needed. We knew why there was not enough research being done. We knew what was needed so that more research would be done. We understood the advocacy needs. And I would say that, you know, the organization is now 24 years old. That really informed the first 10 years, that work. And we just kept going down the list and checking. And of course, to Rafi's point, the huge change in technology, one needs to step back every so often and say, are we still delivering things in the old way? Is there a better way? Are we duplicating something people are getting somehow else? So those kinds of things are important to stay on top of too.
I think so. And I also know your early years with Ovarian Cancer Canada, which I know went through a number of name changes before it became Ovarian Cancer Canada. But you also, as part of this, and I think it probably came from that forum, there were a number of small organizations working in ovarian cancer, and you actually came together over time, sort of just joined forces. And
there was one in particular, and that had been started by 3 survivors. They were struggling. 2 of the women had passed away. And what was happening in Canada, great big geography country, a fairly low incidence, 1 in 70 of ovarian cancer, but still a tragic, fatal disease. And it made no sense for us to have 2 organizations. The clinicians were divided, doing work and supporting both of us. The women were divided. And so we finally were able to get the boards of both groups together to talk about what was best for women in Canada. Not whose name would we have, not who started it. Those things had to fall aside. Ego had to fall aside, and it had to be what's best for the women in Canada. And one voice and one message was obviously best. And that was 2007, and it really created a huge movement then that was very united and poised for advocacy in Canada.
And Rafe, how, for you and your experience with Cancer BD, how important have collaborations been in terms of the clinical community or research community and other patient advocacy organizations?
No, but it's very important to bringing all the stakeholders in one platform, because otherwise you can't measure what the needs is basically appropriate for your country, for your organizations. Because when you are going to design any campaign, so you need to know what is the need. Then you need to know what will be your TG. And after that, you need the strength to continue to run the campaign in your own way, creative, innovative way. So without bridging or listening all the stakeholders, all the community people, what are basically their needs, what they want to, what they are basically facing with. Without their concern, you can't actually design any campaign. So it's really hard to bringing all the person in one platform under one umbrella, which Elizabeth has already told us that they have already struggled a lot, but in 2007 they're in a united voice. But in country like us, we are now, I might say, we are scattered. We are scatteredly doing awareness. Somebody is doing physically, a few communities doing through digitally, or a few is doing as an assistance of the government, and government is itself doing by their ministry. So now it's a scattered platform, and we are trying to bringing all the platform in one umbrella. It could be assistance of the government, but what you have told, that this is very important for any advocacy, for running any awareness, to bringing all the people. And we are facing a few hurdles, but we are kind of tricky in that genre. Because we are doing media advocacy. We are engaging media to bringing all the people in one platform. So whenever I want to throw any masses to the mass people, I just bring a policymaker from the government. I just bring invited a physician from the doctors community, oncologist community, and I call the survivors or who have experienced the cancer. So these are the three strong stakeholders from different community, and then we are talking with the policy dialogues. We are doing some policy dialogues. So this is our, whenever this is the modality, you don't go to the in the physical modality, then it's easy. But for Elizabeth and the other organization who is doing basically so many projects apart from awareness through digitally, that's really hard.
Yeah. And what I think is interesting, and Elizabeth, I'll ask you about this too, but I think what's interesting and quite sensible is that you have drawn on your own expertise in terms of media, communications, that is where your expertise is, and you've used that to lead the development of your organization and very effectively. And that kind of makes sense. And Elizabeth, do you feel that you sort of had a superpower that
No, I don't. I think what, and to your earlier question too, what I found very motivating was I knew with About Face what the cause and the need was. I knew nothing about ovarian cancer. And as I prepared for the job interview, I thought, this is a deadly disease that women my age are getting. And this is far more compelling than a social disability, if you will. And so I think that was very, very motivating. So I was very committed. That was one power, I guess. I think for me, it's I think what Rafi is able to offer, because one thing that I find anyway in Canada, not for profits, we don't have money for media to hire people to do it well. We don't know how to do it well. And so for you to bring that expertise, I'm sure it's just absolutely, shot your organization into the success that it's had, because I would say it's a big gap for us. We do well on programs, and we do well on understanding the community need and what the survivors and the healthcare professionals, we're good partners.
Yeah.
But that is a hard thing. Perhaps what I bring is a very strong belief in partnership and collaboration.
But basically, it's always yes from our side. So offering whatever we have, the limited resources in terms of media or something. So when I was started, my strength was my experiences, my networks. As a journalist, I have a few networks with the state policymakers, a few networks with the community, doctors, oncologist community. And I have a good relationship with the oncology club here in Bangladesh, where all the oncologists remain there doing so many things all together. So I know how the treatment process and their process, their in building development process is going on. So my job is to just the community-based needful the needs let them know what is needful here in Bangladesh for the patients. So they can doing the same advocacy by their way because they have a good connections with the health ministry. So you might say that I'm just doing the middleman works. The cancer BD is doing the middleman works.
Okay, that's a nice way of looking at it, actually.
Very important role.
Yes, because we don't have the strength of doing taking some projects because we don't have the donors, we don't have that approaches yet. So we're doing this. We are picking these things to do for at least next 2 years. And this year we have decided we will do a massive campaign, but it's also through the social media because for the pandemic we have a baseline research that shows us that all the audiences are not willing to sit in front of a television or by a radio. They are mostly taking information from social media.
Yeah.
So we are focusing on social media, and we would like our level best to driving a awareness campaign through the social media this year. Yeah.
And how do you market Cancer BD? How do you make sure people know you're because that's a really lots of organizations. So in the patient advocacy world, it's so hard when you know that you've got really valuable, important, vital services and that getting people to know you.
Very important thing is to reach the individuals, right? So you have so many informations, you have a good amount of information, but you can't reach a single person, individual person. So it's not OD, it will not go OD. So everybody who we are preparing or running any initiatives, we are looking for to reach the individual person, but the organization like us, which is basically running by the donation, individuals' donations are limited resources. So the marketing is very costly for us, very expensive for us, right? So we can't do the traditional marketing over here. We can't spend money for marketing here. Rather, we prefer to spending money on cancer, the deprived cancer patients. Or buying some medicines for the poor cancer patients, financially poor, I must say. So here we must have to take some strategical decisions, and I do marketing again through the media because they have some set of audiences, right? Like the number one channels, television channels have some audiences, number one radio channels have some audiences, and through my network I would like to doing partnership with them, right?
Right.
As we are observing the World Ovarian Cancer Day all together with both the party. We are taking initiatives. We are giving them some ideas. They are taking that ideas and preparing programs, and then they broadcasted that. And we just doing that. We just ensure a participation from our side. And that time, as we have already Rafi Sadnadel over here, Elizabeth is there. So then they are using captions, and they're giving us a platform to showcasing our initiatives in their platform. So it's an unpaid, I must say, marketing strategy for us.
Yes. Yeah. You have to be very opportunistic and,
Yes.
How about you in thinking about Ovarian Cancer Canada and, going back, I guess, to when you first started, and how do you, it's a real challenge for organizations, actually big and small. It's, to get yourself known.
I think, and it's ongoing. It's a heartbreak when a woman calls and says, I hadn't heard about you when I was first diagnosed. So again, I think as Rafa says, building the partnerships. Who knows about you? Do the clinicians know about you? Do the cancer centers know about you? Do the other cancer organizations know about you? And is there any kind of arrangement where you can share information, and partner? And so we went to community agencies that offered cancer support in general. And
Right.
and so I think just constantly getting the word out that way, because to your point, no money for marketing. I mean, it's just not,
No.
it's all word of mouth and not where you want to put your dollars. I think very important.
And I'll ask this of both of you really, but I'll start with you, Elizabeth. How important, or how do you balance, I guess, the need to have a vision and a focus and a plan, with also the ability to be resilient and take opportunities without, chasing kind of stray ideas? So have you become more confident and comfortable over time with your judgment on when to, pivot and when to stick to the plan?
Yeah, I think that for me, it's always remembering that most of the funding that we have is public donations. It's people who lost a loved one or are caring for a loved one. And those are precious dollars. And it's an incredible vote of confidence for them to give you that money to help someone else. And so I feel an incredible onus for that. So very cautious about, are we duplicating something that someone else has done? Are we inventing a new program that someone else may have already invented for another cancer, but we could modify it for our disease? So really trying to think about all those dollars. And I think there are hard decisions. You sometimes lovely to chase that shiny penny, but if you stay true to your plan, and there are hard decisions. I remember hearing a lecturer once talk about organizations that go on and do the same thing year after year after year, and don't look at what's happened in the environment, and don't see that social media is the way, and people are getting information themselves, not just from their doctor. And she called letting go of things that you really love to do, but you really see are not going to lead to your theory of change to overcome the disease or save people's lives. She called them letting go of your cherished theories.
Oh.
Wow.
And so we use that language a lot. What are our cherished theories? And for us, it was a lot of energy put into flyers at health fairs.
Okay.
And it was a lot of volunteers to organize, a lot of energy. And in our particular population geography, we had to come to believe that that wasn't going to save lives, that there were more targeted ways to find people who were at high risk, who had a family predisposition, or who were already living with the disease, and we could help them. So that was a cherished theory that we had to.
Very interesting. It is hard to change, and things feel like they're successful and people that you meet will appreciate it, but is it the best?
Yeah, and your community likes those things. So it's a big shift when you say, we're not doing that one anymore,
And Rafa, have you had that experience too? Have you had to let something go, or perhaps, not take something up that you really wanted to do, but just, not wanting to lose your focus?
Basically, I have facing a similar same thing here. Just a few months back, in the pandemic, when the pandemic started, so there were so many struggles for the cancer patients. They can move, they can continue their chemotherapies cycles. So it was a haphazard situation here in Bangladesh also. And at that time, as a developing country, we have a few more patients who is very under the poverty level. So they have stuck in the hospital. Even they don't have the money for their daily food, daily meal, so forth. So we have initiated a small donations by our community, and we have just go over there and found a very pathetic scenario over there, because the patient is in the bed, but the attendees of the patients are moving around, roving around, but uh, but they are actually looking for foods. And we have given a few foods, dry foods, to them over there, in the National Cancer Institute Research Institute arena. So this is very inspiring for us,
Yeah.
because we have finally connected those people who we want to, with our limited resources. So I was very delighted by myself that we have recognized the actual needy people over there, because this is very important to recognize who is the person is looking for your assistance. Whenever we are doing a general awareness or general projects, so then we rarely picked the right person to give assistance. So in terms of our resources, our donations, these are very precious thing,
Yes.
because a few of the people of the from the society who have suffered cancer, directly or indirectly, they are actually willing to pay you for the cancer awareness. So these are very limited, and for the same reason, these are very precious. So we have to find the right people to assist.
Wow, that's a
So
really powerful way to describe that, actually. I mean, and it's,
yeah,
you know,
yes.
Very
So
moving.
yeah,
these things inspires me a lot. Inspires us a lot, basically.
yeah. It can keep you awake at night, wondering how best to
Yeah.
use the
Thank you.
resource that you have, and to see such great need and not to be, you know, able to do what I'm sure you want to do, which is address all of it. So for you, that prioritization and focus and finding the people that really need you is, you know, incredibly important. I think that's really amazing. So thinking back over your experiences, do you have, you know, if you were to give someone who was today thinking about setting up their own organization or their own version of Cancer BD, what, you know, would you have advice for them?
Not actually advice. We are not such a big organization like we are able
But
to
from
say.
your experience, what, you know, what would you
Yeah,
say? I
yeah.
wish I'd known.
I can wish I can give some suggestions to them very politely, because please do it in your native language. Obviously, you
Okay,
will
yeah.
put the international language English will be used, but please do separate copy Xerox in native language, because a few people who have educations, but they are willing to having informations in native language. That's more easy, more connecting to everybody. And the second thing is, please do advocacy. Focus on advocacy first. Bringing all the stakeholders in one platform. That is very much important. And please listen to the audiences. Listen to the target people first. Try to collect what they are willing to have before planning anything. Anything you have, anything you want to, because whenever we are starting any initiatives, we have plenty of things in our list. We will do these things, we'll do that things, but that's not important what you want to do. That's important what you have to do, and you need to know that things from your target people, because they're suffering, not you the people who is suffering. You are there, you have suffered, or you are there right now to assist them who is suffering right now. So please
I think
listen to
that's
them.
really a really excellent way to put that, to focus on what you have to
Right.
do and not on what you want to do. And I think it can be, I think, especially for founders, you know, you
Right.
start out with your
Mhm.
you know, motivated by a personal experience, and you know that very well, and you want to redress that. And so that can kind of, you know, drive your path for many, many years. So I think just that little nugget of focusing on what you need to do and not just what you want to do is incredibly important. Elizabeth, how about you?
Yeah, sure,
Well,
sure.
I think not terribly different. I think that's the key, is to know, obviously founders come with incredible passion, commitment, and a vision, and to make sure that that matches what the need is. Because again, it's going to take public dollars. And so stepping back to see what else, and I, you know, I have seen in other organizations, founders who it was just so important to own it, when in fact they might have been more effective in a partnership with someone else and been able to achieve their goals and help their stakeholders more quickly. So I think there's a piece of it that you need to bring your commitment, but your head too, not just your heart, but your head, so that you're making wise decisions and being very focused. Because when you start off, there is so much that needs to be done. So what you want to do versus what you have to do, and staying focused on that. And I know some of the greatest successes that we've had with Ovarian Cancer Canada have been because of that focus. And I'll just reference, we were so fortunate to get federal funding for research, which is really going to change the landscape in Canada. And it took 4 years. And, you know, what never happened, we knew it would take 4 to 5 years. And the feedback we got from the politicians, from the community, and even the researchers who in the beginning didn't believe we could do it. They said, you never changed. Yeah, you never changed the message. You never changed it. When you saw success coming, you didn't say, we want more money. You kept the plan the same, and we were just focused. And I think that sends a good message, and it led to success. So trying to be as focused as you can in the face of such great need is one of the biggest challenges.
For sure. And I think you've touched on the other thing, which is you have to be, you know, there's so many things going on, and you have to be your own marketer and your own advocate and your own services program person that, you know, it's hard. And that's sometimes I wonder if you lose focus a little bit when you're spread so thinly.
Yeah. Well, I think for us, building the community, we had to build the community, as you have, Rafi, on the web. We had to build the community. Then we had to talk to the community and get them to understand the value and to trust us. And then we had to train them to be advocates. So it took, you know, 20 years. If you look at the breast cancer and prostate cancer movement globally, the AIDS movement, it takes that long to get traction, to get a result. And it's the patience and the focus.
And so I guess it's always about growing with that, to, you know, with each passing year, you sort of grow a bit more and develop. So we're kind of coming to an end. So are there any last thoughts about, you know, what you've learned from your experience of for example, Rafi, setting up Cancer BD? What's your proudest achievement, I guess?
To reaching the people, mass people, is our achievements and nothing else. And listening, we have getting a few opportunities to listening to them, and a few things we have advocated for a long time to putting the government a few fund for bringing some free medicines, free chemotherapy medicines for the governmental hospitals. And finally, we have got to know that they have initiated around 2 crore for each individual's government hospitals who have the cancer departments and divisions over there. So that's not actually our achievements, that's our country achievements and all the stakeholders achievements. And these are the achievements, but I will count the achieve. I will count the point that I have the opportunity to communicate with the cancer patients, cancer survivors, the sufferers, the victims over there, to listen their needs. And I count my organizations, our organizations, Cancer Beauty, will be the voice of those causes, the voice of those needs. And this is what we are looking for, we are focusing at. And finally, I would like to suggest, I would like to share one thing, that whatever the initiative is we would like to do, please share with the more people we can, with our own network, with my friends' network. Please use all the networks, because without the collaborations, alliances, we can't actually do. We can't actually get a better output from those. So I would like to request all the persons who have initiated or who have worked with some initiatives, please do advocate and keep networking.
Well, I think you've summed it up really well. And also, I think your organization, as you were talking, I think it really demonstrates how, the efforts of a few people can have such profound impact, and the willingness and ambition to create a community around cancer and work together and collaborate is how change happens. And so it's really, very inspiring to hear your story, and to
Thank you.
the work that you've done that has been so impactful and so interesting. And Elizabeth, to you, I think you might have already shared your something that you're very proud of, but is there anything else that you would like to share?
Well, I think, yes, getting the research funding is, I feel that that's something that I had never done advocacy work before. I had to learn just like all the other volunteers. And I found it incredibly powerful to have your voice heard and to know that you were bringing information that wasn't known. So that it was very rewarding work. I think that my message, and you've said it, Clara, and Margaret Mead said it best, of course, about a group of people, but that individuals should never doubt that they can make a difference, because you can. In something that's important to you, you can make a difference to your community, to your family, so I just think that if you keep that there, then you never feel hopeless.
Yes. Yes.
Right.
Thank you both. That was so interesting. And I think just really nicely, and it's so interesting, clearly you're, in different countries and in different contexts, but, such similar messages about working with the community and being there for the people that need you, and building networks and collaborating. So it's just, I think, really an encouraging kind of insight into the experiences of people who just take on such, huge challenges and, unwaveringly carry on and make a difference. So, so it was really interesting talking to you both.